How can you avoid getting cancer? 5 mistakes almost everyone makes. Do you think cancer is just a matter of chance? Yes, but only in 60% of cases. But for 4 out of 10 people, it happens because of specific lifestyle mistakes. Another 10% of cancer cases are linked to genetics, which you can control, for example, by taking a genetic test and creating a personalized diagnostic plan. So this means that you have the power to protect yourself from cancer in almost half of all cases. Today, I'm going to tell you about 5 dangerous mistakes that can lead to tumors. In this episode, you'll find out which habit shared by millions kills 1 out of every 5 patients with a diagnosis, why you need to watch not only your moles, but also old burns and scars, and which vaccines you should get to prevent cervical and liver cancer. And finally, we'll answer the most common question people ask oncologists: what tests should you take to make sure there are no tumors in your body? Good afternoon. I'm Vladimir Ivashkov, a surgeon and oncologist. Today, we're going to talk about mistakes we've been making for years, often without realizing that they actually increase our risk of developing cancer. Let's start from the end. Mistake number 5, burns. And right now, I'm not talking about ultraviolet light, although, of course, ultraviolet radiation is truly poison for your skin, and that's not a metaphor. The World Health Organization has put it in the same category as asbestos, tobacco, and uranium. Sunlight is a Group 1 carcinogen. A severe sunburn increases your risk of melanoma several times over. When you get a sunburn, your skin cells suffer DNA damage that accumulates over the years. And those who get burned every summer because they think SPF is for wimps are increasing the number of mutations in their cells, and with that, their risk of developing cancer. What many people don't think about is sunburns in children. They also have a cumulative effect. You can get sunburned 10 times as a kid and end up with melanoma as an adult. Even 15 or 20 minutes without protection can damage the DNA in your cells. Keep this in mind when you're getting not just your kids, but yourself ready to go outside. And please don't think that tanning beds are any safer. On the contrary, quartz lamps hit you with ultraviolet rays 10 times stronger than the midday sun. But what will really shock you is that it's important to keep an eye on old burn scars, like those from boiling water or fire. I actually have one myself that I watch very closely. Usually nobody checks them, but it's in these old burn scars that squamous cell skin cancer often develops. The wound heals, the scar remains, and the cells keep mutating for decades. Just have a dermatologist check it at least once every few years. Remember, your skin doesn't forgive mistakes. It remembers every burn, every time you got sunburned at the beach. And one day, that memory could turn into a diagnosis. Now let's move on. Mistake number 4 is skipping screenings and ignoring warning signs. Not every cancer can be prevented, but most can be caught at the very earliest stage. And here's the main mistake: waiting until something starts to hurt. I often hear these kinds of folk symptoms during consultations. Doctor, I'm perfectly fine. My weight is normal. I can't have cancer. None of my lymph nodes are swollen. The thing is, sudden weight loss and pain don't always happen. Very often, patients feel perfectly fine right up until stage 3 or 4. Early stage cancer usually doesn't have any symptoms at all. It's a silent process. The tumor grows quietly and unnoticed, without bothering the person in any way. So what should you do? You're probably wondering. Screenings are one of the few tools that can really help protect you from cancer. They're more useful than any vitamins or broccoli combined and multiplied by 10. Blood tests, mammograms, HPV tests, and cytology, and starting at a certain age, CT scans of the lungs and colonoscopies. These are the very procedures that detect precancerous conditions and can spot a tumor long before you'd ever feel anything. But people put them off, get scared, and justify their fears by saying oncologists just want to treat someone. You've probably heard all those lines about how if you go to the doctor, they'll definitely find some disease. Well, of course, that's not how it works. So what warning signs should you never ignore? Moles that are changing, bleeding outside of your period. Basically, any unexplained bleeding where it shouldn't be is a bad sign. In your phlegm, urine, stool, and so on. Don't forget about untreated dental issues. It's not just cavities, it's a chronic source of infection that can end up causing oral cancer. Persistent pain that lasts for weeks or months. Remember, cancer rarely appears out of nowhere. Most of the time, it shows some signs, and it's up to us whether we notice those signals in time or not. Mistake number 3, smoking. And I'm not just talking about cigarettes here. You all probably know that smoking is the #1 cause of lung cancer. But not many people know that tobacco is linked to 13 different types of cancer. Take a look at this human model. Tobacco smoke destroys everything it comes into contact with. Lips, palate, larynx, tongue, throat, esophagus, stomach, pancreas, bladder, and many other organs that honestly you wouldn't even think are connected to smoking. Everything's at risk. Just imagine the path tobacco smoke takes, starting from the lips and ending at the anus. Everything it touches damages DNA. 22% of all cancer deaths are caused specifically by smoking. Yes, the number of smokers worldwide is going down, but tobacco companies aren't giving up. They came up with new forms of supposedly safe smoking. Vapes, heated tobacco systems, hookahs. They promise us less tar means it's safer. But the truth is, instead of tar, there's propylene glycol or vegetable glycerin, and it's these substances, together with nicotine, that trigger processes which speed up cancer progression. And most importantly, according to research, tobacco replacement systems, heated tobacco, and tobacco warming devices actually lead people to use them more often. Where someone used to smoke 1 cigarette, now they use heated tobacco systems 10 to 15 times. Here's what a recent study from the United States says. They took mice with malignant tumors and for 4 weeks straight exposed them to vape vapor for just 1 hour a day. Do you know what the result was? Vaping increased the metastasis of the tumor. In other words, the tumor started to spread faster. And this effect has been proven not only in mice. In women diagnosed with breast cancer who used nicotine delivery systems, metastases appeared almost 5 times faster than in those who didn't smoke, 188 days versus 926. The study included nearly 64,000 participants. In men diagnosed with prostate cancer, the results were similar. Now, imagine that someone already has malignant cells in their body, since vaping can potentially speed up their division. Remember, there's no such thing as harmless smoke, and those who think vaping is safer than cigarettes today will get their answer in 20 years. But unfortunately, that answer could be extremely grim. By the way, what do you think? Is vaping just as dangerous as smoking cigarettes or not? I see people vaping literally everywhere, at work, in cafes, during meetings, even at the gym. Let me know in the comments how you feel about them. But it seems like they might be even more addictive because they're so much more accessible. We're getting close to the 2nd place in our ranking of mistakes. I called it ignoring your roots. Now we're going to talk about genetics. When a doctor asks you what illnesses your mom, dad, grandpa, or grandma had, it's not just a formality or idle curiosity. Information about your family medical history isn't just for checking a box on your chart. 1 out of every 10 cancer patients is someone who inherited the disease. If your family has had cases of breast, ovarian, or colon cancer at an early age, meaning before 40, there's a chance your cancer risk is higher than average, sometimes several times higher. Let's do a quick test right now to see if you have any genetic risks for hereditary cancer. The more times you answer yes, the more reason you have to be cautious and see a genetic counselor. So, is there a type of cancer in your family that gets passed down from generation to generation? Do you have close relatives who were diagnosed with cancer before the age of 40 or 45? Does any close relative have several different types of cancer? For example, breast cancer and ovarian cancer. Do you have Ashkenazi Jewish relatives? Are there family members with rare types of cancer? The more times you answer yes, the higher your risks. What should you do if you answered yes to some of these questions? Go see a geneticist. They may suggest you take genetic tests. These tests can help determine how high your individual risk of developing cancer is in each specific case. If you have a young relative in your family who developed cancer and that relative is available, it's best to bring them with you to the geneticist because the geneticist will start their investigation with them. That way, everything will be accurate and clear. My patients who have faced malignant breast or ovarian tumors at a young age often ask me if it's necessary to test their children for mutations. This rule applies here as well. It is best and most accurate to test the mother, the person who has already gotten sick. If there really is such a risk, the doctor can suggest an individual screening plan, and in some cases even perform preventative surgeries to reduce the risks. Finally, we've reached first place. This is one of the most common causes of cancer. And this is exactly where, as an oncologist, I hear the most resistance. If people are still willing to put up with cigarettes, and sometimes even admit they're harmful, here the number of arguments against is off the charts. It's not a big deal. It's hereditary for me, and there's nothing really scary about it. But the statistics are stubborn. Chronic inflammation and excess weight increase the risk of at least 15 types of cancer. Obesity is the second most significant risk factor for cancer after smoking. Fat tissue is an endocrine organ. It releases estrogens and pro-inflammatory cytokines, which means it triggers processes that push cells toward mutations. Chronic inflammation works the same way. Untreated inflamed teeth, gastritis, ulcers, hepatitis, and human papillomavirus, all of these create an environment where cancer cells feel comfortable and start to grow. Remember, obesity and inflammation are not just background issues. There are real drivers of tumors. And ignoring them means consciously taking a step toward cancer. We've gone over the 5 main mistakes that pave the way for cancer: sun exposure and burns, smoking, vapes and hookahs, avoiding checkups unless they're scary symptoms, not knowing your family history, as well as chronic inflammation and excess weight. Yes, not every case of cancer can be prevented, and not every smoker will get sick, but in my opinion, we can either prevent or catch a huge number of cases at an early stage if we simply acknowledge these risk factors. Your health is the result of the choices you make every day. Don't make these mistakes. Pay attention to your body, get regular checkups, and then cancer will have far fewer chances. Thank you, my dear viewers, for watching my channel. Please subscribe.